Welcome to your pediatric inpatient rotation, also known as the purple and green teams. I'm Catherine Beatty, one of the hospitalists here at Children's Hospital, and your purple and green attending. During this video, I will be orienting you to your inpatient rotation. We ask that you view this video prior to your first day on service, and refer back to the handout that accompanies this video, as you will be expected to be familiar with their content. During this orientation video, you will learn the details of your daily routine, duties and expectations of the purple and green team residents, about Feedback Friday, and resources for teaching medical students. The LSU Pediatric Inpatient Service is located at Children's Hospital in New Orleans. The purple and green teams are general pediatric medicine teams and are staffed by the CHIPA Hospitalist Group. The teams are made up of the following: CHIPA hospitalists, community pediatricians, 2 upper-level residents, 2 interns, acting interns, and third-year LSU students. Our goal is to provide you with exceptional general pediatric inpatient experience while delivering world-class care to our patients. We believe the best care happens when the medical team works together with each family to provide individualized care. We encourage families to take an active role in patient care by doing family-centered rounds. Residents and students do daily patient presentations in the patient's room so that family can take part in the decision-making process. The daily schedule for the purple and green team is fairly consistent and as follows. 6:30 a.m. is team checkout. In the mornings, you will see patients, write notes, and call consults. From 8 to 9 a.m., you will be in morning report. 9:30 is the beginning of family-centered teaching rounds with your CHIPA faculty. 12 to 1 is noon conference. In the late mornings and in the afternoons, you'll be seeing new admits, completing floor tasks, patient follow-up, and communicating with general pediatricians. At 3 p.m., or whenever the afternoon work is done, there will be afternoon rounds with the CHIPA attendings. 7 p.m. is team checkout to the night float residents. The purple and green team experience may be different from other inpatient experiences you've had. While on other rotations, patient care may be predetermined by roadmaps. On the purple and green teams, you will be the one dictating patient care, with help from your attendings, of course. We expect that you will take ownership of these patients, and you will need to read about your patients so that you will know how best to treat them. Think of this as immersion into pediatric medicine. There must be a full and thorough resident H&P completed for each patient. You must document 12 review of systems on each H&P. Student H&Ps should be co-signed by a team resident, but again, the resident must complete a full H&P. Each resident must write a full daily progress note on his or her patients. Medical student notes must be signed by the resident. AIs, notes should be co-signed by the upper-level resident. And unless unexpected patient care circumstances arise, your notes are expected to be completed before rounds at 9:30. The members of the purple and green teams really do work together to function as a team. Each member of the team has a specific function depending on his or her level of training. Upper-level resident expectations. Upper-level residents are the team managers. They carry the admit pager, examine all patients each day. They write progress notes behind acting interns, examine and write daily progress notes on consults, review daily presentations with the students prior to rounds. They help teach the students. They make sure all paperwork is done and on the chart for each patient. They know the details for each patient, and they understand the big picture and anticipate discharge plans. Intern expectations. They are primarily responsible for patient care duties. They carry the floor pager, examine the patients, and write all the daily progress notes except on patients followed by the AIs. They must know all the details for each patient, including a list of all medications with doses, including IV fluids, and the placement of any IVs or hardware. They must know every aspect of the patient history, even if the patient was admitted by someone else. Practice teaching the students, and completes discharge paperwork, which must be faxed to the primary care physician. Once each week, usually on Friday, there will be time set aside for feedback sessions. These sessions are not formal evaluation sessions. These sessions are an opportunity for each resident to meet individually with their attending to ask questions, set goals, and talk about how the week has gone. These sessions should be helpful to you and not anxiety-provoking. Included in your orientation handout, you will find 2 resources you may find helpful when teaching third-year medical students, both of which are available on Moodle for these students. The first is an approach to the progress note and presentation. The second is an example of a daily SOAP note. On behalf of all the CHIPA attendings, I want to welcome you to the Purple and Green team. We are all dedicated to resident education, and if you have any questions, please come talk with us. We hope that you will have a great rotation and you'll find the inpatient service to be both an enjoyable and high-yield experience. Thank you for your attention, and I look forward to working with you soon.